A nucal cord during pregnancy is often quite a big anxiety or concern for many mums, and a nucal cord is where that cord is wrapped around the baby's neck. Now this is worth watching and save if you want to know the evidence on the outcomes for these babies, the prevalence, but also whether it is actually a problem or not. So the first thing to note is the physiology actually means that your baby is not using its neck or its throat to breathe oxygen during pregnancy, okay? So the placenta is providing all the oxygen your baby needs through the cord into your baby's belly button. It's an incredible transition that these babies make and how they grow during pregnancy. And so actually a cord being around their neck during pregnancy doesn't mean really much at all. And the cord itself is completely surrounded by Wharton's jelly. So it protects those blood vessels from being squeezed, from being squashed, and it means that even being around baby's neck tends to not be a concern for the majority of babies. The other thing is the Wharton's jelly actually helps the cord to be able to move as well during labour and birth. It tends to be more the length of the cord that has more of an issue as opposed to the actual placement of that cord. And when a baby is born with a nuchal cord, baby's normally born and we tend to do a bit of a somersault to be able to unwrap so that baby can then take its first breath in. We tend to do a bit of a somersault movement as a midwife. We no longer recommend unwrapping a cord or cutting and clamping as the head is out but not the body at that stage, because it's not really going to make a huge difference, and actually it can potentially cause more problems because if you touch a cord it can cause vasospasm, so actually it can stop it from continuing to provide that oxygen to babies. Also, if there was a concern with the shoulders being delivered and you had cut and clamped the cord like they used to 10, 15, 20 years ago, actually you've just cut off that baby's blood supply. So very important not to do that until the baby is out. So we tend to unravel the cord now when the baby is born. Now the other adaptation which really helps to protect your baby if they've got a nuchal cord is the amniotic fluid around your baby. So those waters around your baby actually protects the baby from the squeezing contractions. So we know that if the mum's waters are intact for longer, actually it really helps with any pressure that's happening during those uterine contractions. And why I said the length of the cord is probably more important is because you've got a really short cord where that Wharton's jelly is going to flex a lot more and put a lot more pressure on the oxygen supply as that baby comes down and is squeezed through the birth canal, as opposed to a longer cord that actually can facilitate and sustain that for longer. Studies and the research that we had really highlight this. So in a retrospective study, so this is a study looking back on cases of 350 women, the authors found that a loose nuchal cord doesn't actually increase the chances of a caesarean birth. However, a tight cord around the neck, so that will be where there's not as much length within the cord, actually might result in lower APGAR scores at 1 minute and an increased chance of fetal distress and labour because of how thin that Wharton's jelly will become and also that increased pressure over time. And nuchal cords are really common. A large study found that nuchal cord was present in 8.9% of births, and that actually babies who had cords wrapped around 2 or 3 times was actually far less likely during the birth. Only 0.6% of babies had 3 or more nuchal loops. Now, over the years as a midwife, I've seen lots of births and lots of babies who have been born with a nuchal cord around the neck, and lots of them have successful vaginal births, no problems, no concerns. It just comes down to how tight they are. I've certainly had one baby who had the cord wrapped around its neck 3 times and was okay, and several babies have it twice around the neck. The once around the neck is an incredibly common feature in a lot of births. And having 1 or 2 loops of cord was not associated in this really big study of women with any adverse outcomes for babies. But we do know that having 3 loops around the neck for babies does increase the chance of growth restriction and adverse outcomes. And that's probably because actually the more times it's wrapped around the neck, actually the tighter and more constricted that Wharton's jelly can become. And so actually it's another indicator as to why we need to be measuring the bumps during pregnancy and referring on for ultrasound and growth scans during pregnancy if we have any concerns about growth. And it might be a feature that they can see potentially on a scan. And in even a larger study of 219,000 births, only 6.6% of babies had a tight nuchal cord compared to 21% who had a loose nuchal cord around the neck in a baby. The differences that they found between the 2 groups wasn't very significant. They found that there was a small increased chance of those babies who had a tight nuchal cord that had a slightly longer gestational period during pregnancy. They had slightly lower birth weights, and they were more likely to be a male baby or to have it or to be a first-time mum, and in singleton pregnancies with a shoulder stocia. And in the tight nuchal cord groups, there was also a small increased chance, so about a 1 in 200 extra chance of having a neonatal admission compared to babies who had a loose nuchal cord. So to conclude, a nuchal cord shouldn't be feared. It comes down more to whether it's loose or whether it's tightly applied as to whether it could have any concerns during pregnancy in terms of growth restriction, in which case your midwife will be monitoring that during pregnancy very frequently. And we also manage it during the labour process by monitoring babies either with intermittent auscultation or with a CTG, depending on risk factors during pregnancy, labour and birth.